Hi, my name is Marissa Seach. I'm a nursing student at the University of Nebraska Medical Center. Mental health is a topic that should be talked about more often than it is, as it affects a large portion of our population around the world. According to the 2023 statistics from the World Health Organization, 280 million people suffer from depression. Depression is often associated with suicide, and more than 700,000 people complete suicide each year. Thousands of people are hospitalized each year for the treatment of depression alone. It is important to continuously strive to improve the care for these patients in an attempt to improve their quality of life and prevent depression from leading to thoughts of suicide. It is important to use an interdisciplinary approach to improve the care of our depressed population because each practitioner has their own area of expertise. Each patient's care plan should be individualized, and daily interdisciplinary rounds should occur. Checklists can be used during rounding to ensure efficiency and that critical components of the care plan are not missed. An interdisciplinary team should be made up of psychiatrists, psychologists, nurses, dietitians, pharmacists, social workers, and chaplains. In a 2019 article, Ferenchik et al. Wrote that psychiatrists can screen for patients for depression using questionnaires. Psychiatrists can then diagnose depression using the Diagnostic and Statistical Manual of Mental Disorder 5th edition. A psychiatrist can then order treatments and medications while overseeing the patient's entire treatment plan. Psychologists then carry out treatments such as cognitive behavioral therapy and interpersonal psychotherapy. Nurses can build therapeutic relationships with patients and offer emotional support, aid them in the development of coping strategies, and assist patients with setting goals. In 2023, Teasdale et al. Discussed that dietitians can identify nutritional needs of patients who suffer from depression, such as malnutrition and disordered eating patterns. Social workers can help to determine any social determinants of health that a person may be facing that contribute to their depression and can increase hospital readmission rates. Chaplains can assist patients who may be experiencing a spiritual or cultural crisis that may be contributing to their depression. Lastly, pharmacists can complete a medication reconciliation to ensure that any medications a patient might be taking do not have any contraindications or interactions with each other that may worsen a patient's depression. Each member of the interdisciplinary team should meet with the patient to determine the goals of care along with their evaluation of the patient. The different team members should meet at certain times each day on the unit to discuss each patient's plan of care. In 2022, Heap et al. Explained that daily interdisciplinary rounds improves interprofessional communication and collaboration, along with coordination of care and patient-centered shared decision making. Daily rounding is shown to increase the patient's quality of life while decreasing adverse events and hospital length of stay. A 2014 article written by Gunnels et al. Discussed that checklists can be used during interdisciplinary rounding to ensure time efficiency and that critical components of the care plan are not forgotten. These checklists are used as a guideline and can be easily tailored to the specific needs of the mental health unit. The process of implementing interdisciplinary rounds and using checklists can be evaluated in multiple ways. In Gunther et al.'s article, the Joint Commission traced 80% of medical errors to be the result of miscommunication. The strategy of implementing interdisciplinary rounds and checklists can be evaluated by trending the number of medical errors occurring due to miscommunication. Secondly, trending 30-day hospital readmission rates for depression would be helpful, as interdisciplinary rounds have been shown to increase the quality of care provided to patients. To evaluate staff response, an anonymous survey can be created to see how interdisciplinary rounds fit into the workflow and allows staff the chance to share both positive and negative experiences with interdisciplinary rounding. Improving quality of care takes a team that is dedicated and willing to go the extra mile. Join us as we pave the road for the future of caring for those who suffer from depression. Thank you.